I just finished Accutane. When can I start treatment?
That's a great question. Once your acne is cleared up from a course of isotretinoin, or the drug formerly known as Accutane, with most of our treatments, you can start them immediately. There have been 2 consensus papers that have shown that the treatments we offer are safe and effective immediately after a course of isotretinoin. This wasn't always the case. We used to tell people, or people used to be told, that no, you had to wait 6 months after isotretinoin. That is not true. The only thing that you need to wait on is ablative CO2 resurfacing or fractional CO2 resurfacing. Everything else, microneedling, V-beam pulse dye laser, Viva radiofrequency microneedling, and even use of pigment lasers to treat your acne scars, all can be done as soon as your acne is clear on the isotretinoin or immediately after stopping the isotretinoin. And in fact, I encourage my patients to start early. A great way to start is by starting to treat the red marks left behind with the V-beam pulse dye laser, and we often combine that with our medical visits for the isotretinoin. Okay. I have a lot of clogged pores. What do you suggest?
Like hydrofacial or extractions or something? I have a lot of clogged pores. What do you suggest?
Oh, clogged pores. Well, if we're trying to treat your acne, we really need to address those clogged pores, and sometimes our creams are just not enough to address those clogged pores. We will make some recommendations for you for home products and even prescription products that help, but a lot of times you have to combine those with in-office treatments, and a great treatment is a chemical peel with what's called extractions, where those pores are manually extracted or opened, or a hydrofacial with extractions. Hydrofacial uses pressurized water and suction to loosen up the pore, and then it can be extracted. But a lot of times our acne treatments fail because we have not extracted these clogged pores. They really need physical manipulation to open up.
What is your favorite treatment?
My favorite treatment is IPL Intense Pulse Light. It remains one of my favorites because it lightens and brightens your skin, and it treats reds and browns, and it's easy. I can zip downstairs and beg one of the providers to quickly zap my face with the IPL. My second favorite is the 1927 fractional.
What else?
I'm trying to think. My brain's like...
Okay.
These are fun.
I gained weight, and my abdomen, oh, I know. I have yo-yo dieted, and now my thighs are bigger than the rest of my body. What do you suggest?
Okay.
Do you want someone else to ask it?
No. I feel like that is happening.
No, you can. My weight has gone up and down with yo-yo dieting or whatever. Because that's what happens. Okay, go ahead. You can do it.
You need me? I don't know why I'm laughing. Okay. My weight has fluctuated. I constantly go up and down in weight and have gained a lot of weight in my thighs recently. What can I do?
Yo-yo dieting or large fluctuations in your weight can lead to excessive accumulation in one area, like an abdomen or an outer thigh, so that they become out of proportion to the rest of your figure. I think the best treatment for these out of proportion areas of unwanted fat is the in-office procedure of tumescent liposuction, particularly on those outer thighs. It's easy recovery, in-office, local anesthesia, and you just get great results. What's the difference between microneedling and radiofrequency microneedling?
What is the difference between microneedling and radiofrequency microneedling?
Both radiofrequency microneedling and just regular microneedling involve microneedles that are mechanically inserted into the skin. Most microneedling devices are smaller needles that don't penetrate very deeply, and they don't deliver radiofrequency energy. A radiofrequency microneedling procedure, such as the Infinity Genius, has a larger array of needles, so more needles that penetrate more deeply, and the tips of these needles deliver radiofrequency energy. This energy can be delivered through a variety of needles. The Infinity Genius uses insulated needles so that the top of the needle does not deliver energy, it's just the bottom. And then there's non-insulated needles where the whole needle delivers energy. These can be a little riskier because you're getting energy near the skin surface, and particularly in darker skin types, this can lead to hyperpigmentation after a treatment, but both are very effective. A radiofrequency microneedling energy treatment is typically more effective for scarring and rejuvenation and tightening because of that energy delivery. Microneedling without the radiofrequency is probably best used for fine lines or maintenance of results achieved from another procedure.
Do you want to do one where it's personal about Dr. Rostan? Like a personal question?
We can. I was thinking of one like
It's emotional connection.
Why do you have so many dogs?
Okay.
Because dogs are great.
your love for dogs. My love for dogs.
Why do you
Okay.
have so many dogs?
Because I love dogs. One of my greatest pleasures in my career and what I do is my relationships with my patients. We just recently had a new PA join the team, and as I introduced her to patients and told her about them, at the end of the day, she said, "Wow, you really know a lot of your patients." And after 20 years, I do know a lot of my patients. And I think that's one of the most rewarding things about what I do, both medically, medical dermatology, and cosmetic dermatology, is number one, helping patients achieve their goals in terms of healthier skin, better looking skin, more youthful skin. And number two, developing a long-term relationship with these patients. At this point, some of the patients I treated as kids are now coming in married and having kids of their own, and that long-term relationship and seeing things mature over time is just, frankly, is one of the things that drives me to continue working so hard and coming in every day and doing what I do. I get together with some of my colleagues who also practice cosmetic dermatology, and we just feel so blessed. Modern cosmetic dermatology, we have so much to offer patients in so many ways that they can reverse sun damage and aging and create healthier skin and prevent sun damage and aging. And the treatments that I offer in medical dermatology is completely different than when I was a resident. And we're curing psoriasis, and we're really helping eczema, and all this just makes it just frankly a great job. And that's why I love my work.